We're here in the Mirpur slum with the Operation and Maintenance Committee for Mirpur Slum's Water and Sanitation Project. This is a committee made up of 9 members, all women. These women have been describing for us the training that they received from our local partner organization. They received training in collecting funds, hygiene education, how to keep the water system clean and how to keep the latrines clean. And through that training, they've been able to administer this project and keep the water points working every day. To ensure the sustainability of our projects, the communities we support are involved in every step of the planning, implementing, and financing of their projects. This is Lily, and she's the cashier for the Water Point Committee. And this is the book where they are recording their loan payments.
Women are mostly engaged with water because of domestic purposes. And they are the managers who go and fetch water from water points, come back and use water for all other household business. So in that sense, in all our projects, we rely on women organization, women community-based organization in that specific slum or in that village to manage the water projects.
Having an important public role as a hygiene promoter or water committee member enhances the women's skills in the community, gives them more confidence, and ultimately makes them stronger and more respected community members. This change is not always welcome by everyone in the community. Our local partner organizations are aware of this and work carefully with the community to explain the importance of women's involvement to the success of the project.
I am a member of the Water Point Management Committee. Every month, our group is responsible for cleaning the pump and tightening the bolts. Monthly, we collect funds from the households needed to pay for operating the water point. We also clean the latrines weekly. We are volunteers and hard workers. We are proud to work for the development of our community.
The projects supported by Water1st include 3 components: water, sanitation, and hygiene education. If we want to have an impact on health, sanitation and hygiene education must accompany the water infrastructure. Many illnesses, especially in young children, are caused by unsafe hygiene practices such as not washing hands after using latrines. Hygiene promoters from our local partner organization talk to community members about hygiene practices that help prevent the spread of disease.
Before the project, the people collected water from the rivers and used hanging latrines. So after we installed a well and pit latrines, everyone used the new facilities. But these people had never used a latrine before. We explained to them how to wash their bodies and wash their hands after latrine use, how to cover their food to keep the flies off.
These are the new latrines. They're constructed by digging a pit, and the pit is lined with 5 concrete rings so that the human waste will no longer go into the waterways. The hygiene educators understand that if the goal of their work is to affect behavior change, the changes must be the decision of the communities and individuals involved.
Since we drilled the new well, our children are healthier. We don't have to make any more trips to the doctor. We find that we are now saving money because we don't have to pay for medicines from the doctor. We're using that money to buy other things for our children, like food and clothes and school books.
I also want to say to you how much I admire the work that you're doing. You know, in the United States, we're very lucky. We don't know what it's like to live in a slum. We don't know what it's like to have to spend our days collecting water. And so I'm humbled by women who maintain their spirits, maintain their faith in order to come together and do projects like this that improve the health and the life of your community.